Nottingham University Hospital's NHS Trust, NUH, offers deepest apologies amidst investigation into medical records breach. The Nottingham University Hospital's NHS Trust, NUH, has issued a profound apology to the families of Barnaby Webber, Grace O'Malleykumar, and Ian Coates, victims of the tragic June 2023 attacks perpetrated by Valdo Calocane. This apology follows the launch of an internal investigation into allegations of unauthorized access to the victims' medical records by healthcare staff. The gravity of this situation cannot be overstated, adding another layer of profound sorrow and distress to the already unbearable grief experienced by the bereaved families. Dr. Manjit Shamer, NUH's medical director, released a statement expressing the Trust's deepest remorse and commitment to transparency and accountability. We are currently conducting a thorough investigation into concerns that members of our staff may have inappropriately accessed the medical records of Ian Coates, Grace O'Malleykumar, and Barnaby Webber, Dr. Shamer stated. This is a matter of utmost seriousness, and we understand the added pain and suffering this revelation inflicts upon families already grappling with an unimaginable loss. We have already contacted the families to inform them of the investigation and pledged to maintain open communication throughout this process. The statement underscores the Trust's unwavering commitment to uncovering the truth and taking decisive action. We will leave no stone unturned in our efforts to determine exactly what occurred, Dr. Shamer affirmed. Our commitment is not just to uncovering the facts, but to taking swift and appropriate action against anyone found to have violated our strict protocols regarding patient confidentiality. We will not hesitate to implement the necessary disciplinary measures to ensure such a breach never happens again. The investigation's launch comes at a time of intense scrutiny surrounding the events of June 2023. Valdo Calocane, the perpetrator of the attacks, received an indefinite hospital order in January 2024 after pleading guilty to manslaughter by diminished responsibility and attempted murder. His actions claimed the lives of two promising 19-year-old students, Barnaby Webber and Grace O'Malleykumar, and a 65-year-old caretaker, Ian Coates, leaving an enduring scar on the Nottingham community. The attacks also resulted in attempts on the lives of three others, highlighting the devastating and far-reaching consequences of Calocane's actions. Adding to the complexity of the situation, an NHS England report released earlier this year revealed significant shortcomings in Calocane's mental health care. The report concluded that his treatment was not always sufficient to meet his needs, and critically, that risk assessments failed to adequately consider the potential for violent acts stemming from his noncompliance with medication. These findings underscore the need for a comprehensive review of mental health care protocols and risk assessment practices. Further bolstering the call for accountability, Prime Minister Keir Starmer announced last month the establishment of a judge-led public inquiry into the events. This inquiry, scheduled to commence within weeks, will examine the actions and responsibilities of various agencies involved in Calocane's care and the handling of the subsequent attacks. The appointment of a retired judge to lead this crucial investigation signifies the government's commitment to a thorough and impartial examination of the circumstances leading up to the tragedy. The inquiry will leave no stone unturned in its pursuit of understanding how such a devastating event could have unfolded and what systemic changes are necessary to prevent future occurrences. The families of the victims deserve answers, and the public deserves assurance that lessons have been learned and implemented to safeguard against similar tragedies. The NUH's current investigation, while focused on the alleged breach of medical records, is inextricably linked to the broader context of accountability surrounding the June 2023 attacks and the subsequent inquiries. The Trust's commitment to transparency and its swift action in addressing these concerns are crucial steps in the path toward healing and justice for the victims and their families. The overarching goal is not only to determine responsibility, but to ensure that the systems and processes responsible for patient care and confidentiality are robust and effective, preventing future instances of such failures. The hope is to prevent such tragedies from ever occurring again, a sentiment echoed by the Prime Minister and the many others deeply affected by this horrific event.